Diabetes is a metabolic disorder resulting in the body's inability to produce or utilize insulin. The hormone insulin is needed to utilize glucose, allowing the body to produce energy and growth for our cells. Abnormally high blood glucose levels cause many diabetic problems, such as damage to the heart, kidneys, blood vessels, nerves, eyes, skin, and feet. When glucose levels are left unchecked, the damage can result in a heart attack, stroke, blindness, and amputations. According to the American Diabetes Association, 20.8 million people, or 7% of the United States population, has diabetes. About a third of this number is unaware that they have this debilitating disease. Since the symptoms of diabetes are so common, treatment is not sought until problems arise. Symptoms to watch for are frequent urination, excessive thirst, extreme hunger, weight loss, fatigue, irritability, vision problems, and numbness in the extremities. The diabetic patient needs to have comprehensive care to ensure that potential problems are taken care of before they cause life-altering circumstances. By utilizing a team approach to healthcare, complications from diabetes can be addressed by a variety of healthcare professionals, such as a primary doctor, a dietitian, eye care specialists, an internist, a dentist, and a podiatrist. A diagnosis of diabetes can be frightening. Through proper education and awareness, a diabetic patient can live a long, healthy, and fulfilling life. Diabetic neuropathy, or nerve damage from diabetes, is a condition in which the diabetic patient's extremities experience deterioration in nerve function. A gradual loss of feeling in the feet, legs, hands, and arms is experienced. Numbness, pain, tingling, a feeling of the foot being swollen when it is not, and weakness are common symptoms of neuropathy. Minor foot conditions, such as blisters, calluses, and cuts, are often ignored as a result of the inability to feel and sense pain. Thereby, this loss of sensation can develop into foot infections, ulcers, and possibly result in amputation. The loss of sensation takes away the natural ability for the foot to feel irritation. As a result of unchecked glucose levels, the nerves in the foot are unable to warn the diabetic patient to sense minor injuries leading to infection. It is imperative that the feet be inspected daily. If a problem is found, it should be addressed by your podiatrist immediately to prevent any complications. Diabetic leg and foot problems are the leading reason for diabetes-related hospitalizations, and diabetes is the leading cause for amputation of the leg and foot. One of the more serious foot problems associated with diabetic neuropathy is Charcot foot. This progressive degenerative condition results in the joints of the feet being subjected to continual trauma and injury. A minor trauma may initiate the process, and the loss of feeling in the foot allows for repeated injury to the joint, ligaments, and cartilage. Symptoms may include insensitivity in the foot and increased warmth relative to the other foot. Signs may include change in the shape of the foot, redness, and swelling. As a result of the nerve damage caused by diabetic neuropathy, the muscles of the foot and ankle are weakened, allowing for instability and dislocation. Advanced Charcot foot causes deformities, which can result in calluses and ulcers as bony protrusions increase pressure with walking and standing, leading to possible infection. If you have diabetes, it is imperative for you to have a comprehensive foot examination by a podiatrist. Diabetic neuropathy can rob you of any and all feeling in your lower extremities, resulting in life-altering complications. The only way to prevent this is by monitoring the condition of your feet daily and utilizing the expertise and experience of your podiatric doctor. Peripheral arterial disease occurs when blood flow to the legs and feet is decreased due to changes in the lining of arteries. This disease is more prevalent and occurs at a younger age in people with diabetes. When blood flow is poor, it is hard for common injuries such as cuts, scrapes, and blisters to heal properly, which may result in infection and possible amputations. Blood vessels are damaged as a result of high blood glucose levels. These vessels are unable to supply the skin and other areas of the body with blood. Peripheral arterial disease can cause a feeling of coldness in the feet, pain in the legs or feet, and sores or infections that heal slowly or improperly. Treatment for this disease may involve lifestyle changes such as quitting smoking, managing blood glucose levels more closely, prescription medications, and possibly surgical intervention. If you or a loved one has diabetes and have symptoms of peripheral arterial disease, it is vital that you have a comprehensive examination by a podiatric doctor. They can assess your risk factors and utilize their expertise and knowledge to care for any issues you may be having. Your podiatrist can help you with treatment of ulcers that are not healing, educate you on the proper footwear for your condition, and treat you for common foot problems. Self-care of a corn or callus can have serious side effects, resulting in infection and possibly amputation if done improperly, and therefore should be avoided. Peripheral arterial disease is a major complication that can result from diabetes. It can cause many major problems for your legs and feet. Through proper education and care from your podiatrist, your feet can be healthy and infection-free. Foot ulcers and infections for the diabetic patient can become serious if left untreated. Since diabetics commonly have diabetic neuropathy and peripheral arterial disease, a minor cut or injury can become a serious infection. The inability to feel the sore and the failure to heal properly can result in hospitalization and possibly amputation. A podiatrist is uniquely equipped to help the diabetic patient care for their feet and any injuries they may have. Common foot problems that can lead to infection are corns, calluses, blisters, ingrown toenails, bunions, warts, athlete's foot, hammer toes, and dry or cracked skin. By keeping your feet healthy and caring for problems as they occur, you can prevent serious foot complications. If you suspect that you have a foot ulcer, you must seek treatment from a podiatrist immediately. Infection can be prevented through comprehensive care and education. Minor cuts or even cracks from dry skin can turn into ulcers. Your podiatrist may treat a foot ulcer by cleaning and disinfecting it, applying a dressing, prescribing antibiotics, or with surgical debridement, which removes the infected tissue. To protect the area and preserve the dressing during bathing, the utilization of a waterproof plastic covering may be beneficial. If the infection has reached the bone and is unmanageable, amputation may be the only option. The best method to prevent foot ulcers and infection is to stop them from happening at all. To accomplish this, the diabetic patient must maintain optimal glucose levels, inspect their feet daily, and see a podiatric doctor at least yearly. If you suffer from diabetic neuropathy and/or peripheral arterial disease, you should see your podiatrist more frequently. Injuries or problems should be addressed by a podiatrist as they occur. It is also important to follow basic foot care, such as wearing comfortable shoes and socks, as well as practicing proper foot hygiene. Early detection of foot problems for the diabetic patient is essential to prevent ulcers and infection. Your podiatrist is integral to your health and well-being. Preventing diabetic problems is essential to leading a healthy, fulfilling life. Following a proper eating plan, exercising, monitoring blood glucose levels, taking medications as prescribed, quitting smoking, caring for your eyes and teeth, and checking your feet daily are important things you can do. With 26 bones, 33 joints, and more than 100 tendons, muscles, and ligaments, the human foot is one of the most complex structures of the body. Diabetes can compromise your feet through diabetic neuropathy, peripheral arterial disease, and the inability to heal properly. Taking proper care of your feet is one of the most important things you can do if you suffer from diabetes. Ways to care for your feet are washing your feet daily and drying them thoroughly, checking your feet every day for sores, cuts, blisters, calluses, or other problems, rubbing lotion on your feet if they are dry, avoiding the areas between the toes, cutting your toenails once a week or as needed, making sure your shoes are fitted properly, always wearing shoes or slippers to protect your feet, always wearing socks to prevent blisters, wearing diabetic shoes or orthotics as prescribed, feeling the inside of your shoes periodically for sharp edges or objects that could injure your foot, never walking barefoot. If you have an injury to the foot, prevent infection from moisture by utilizing a waterproof plastic covering. Consulting your podiatrist immediately if an injury is not healing properly or infection is suspected. Seeing your podiatrist yearly or more frequently if advised. Diabetes is a frightening disease. Through proper education and care, the diabetic patient can live a healthy and active lifestyle. Monitoring the health of your feet is imperative to maintaining your mobility and freedom. By taking the time to care for yourself, you can live a long and energetic life.